From the station that's on your side, this is Channel 7 News Daybreak.
Welcome back. The time now is 6:23, and women, it's time for you to listen up this morning. You've certainly heard of pap smears, but are pap smears a thing of the past? There's been some new information coming out about pap smears, and joining us this morning to explain is Baptist Health's Dr. Martha Rueda with Sherwood Family Medical Center. Good morning to you.
Good morning.
Thanks so much for being here. We want to get straight to it because there has been new information about when we as women need to get pap smears. But first off, what is the reason that we do need to get one?
Okay, the important things we need to understand that pap smear is a screening test. They look your cervical cells to try to be sure that it's normal or not normal. Who need it? Any women between 21 and 65. However, if you are a teenager and you are sexually active before 21, definitely talk with your PCP because pap smear needs to be done.
What are some of the reasons for an abnormal pap smear?
Could be many reasons, but the more important is because your cells are changing. So can be due to infection, for example, HPV, may the risk that you develop cancer, correct? Especially 16 or 16-8. So the important is infections. Also, the idea when we do the pap is to be sure if the cells is normal, because if it's not normal, no, we say ask us when the cells are little changed in the cells and the shape, and after that, we can change more, and we say that person have dysplasia 1, 2, and 3 cancer or precancer. So this is the thing that we want us to do the test to take the cells earlier and able to treat the patient and prevent that person develop cancer.
You mentioned HPV. Is an HPV test the same as a pap smear?
No, it's different. Any female who have pap smear that is abnormal, we test for HPV. If HPV is positive, most of the time we send that patient for colposcopy. That is a different test.
And does pap smear test for other STDs?
No, pap smear look the infections too and the pathology cells. So when we do the pap, they report your cells, but also we can get information about the infection. So they can say that patient have a clue cells or vaginosis, that cells are infected with herpes 1 or herpes 2, that cervical cells are infected with HPV. So that vaginal smear that we get have 3 components. So we can look infections, but we are looking at the pap smear. This is screening and normal cells to prevent, to be sure that the patient is not developing cancer.
For a long time, women were told they needed a pap smear every year. That's since been changed.
That has been changed. So the difference is if you have pap smear before that are normal, now we recommend you have pap smear every 3 years. If we do HPV, and actually your HPV is negative, that person can have pap smear every 5 years. But nothing has been changed. The test is exactly the same. The examination is exactly the same. We have to send the smear to be done in pathology. The difference is instead to have it done every year, you are going to have every 3 years. However, if you have risk because you have a normal pap smear before, definitely that patient most of the time continue every year having pap smear done. Where? When you go for your physical exam. So the difference is when you go to the physical exam, you have pap smear normal, maybe that day we do only blood test, physical examination, but we don't do pap smear. But it's not, we do every year or every 3 years, so nothing has been changed.
You still need to go see your doctor every year to get a physical exam.
A physical exam is every year, and this is what we recommend. The difference is pap smear can be every 3 years or 5 years if you have normal pap smear before. If not, every year.
Every year, you've got to still go and see that doctor. Dr. Rueda, thanks so much for being here this morning, as always. And here, if you have any questions, call 1-888-BAPTIST.